Namaskar. Myself, Dr. Santosh Kumar Verma, member team Pharma Lok, and presently work as a principal Quantum School of Health Sciences, Roorkee, Uttarakhand. Now today, Pharma Lok presents faculty student development program, an invaluable series of 10 lectures on the special occasion of World Pharmacist Day. Now, I welcome today's eminent speaker, our respected Professor Geer M. Ishaq, sir. Please, sir, you are most welcome.
Thank you.
Now, with the permission of sir, I want to read his credential as
Yes,
a
sir. Please
brief
go ahead. Please go
biodata.
ahead.
Ji. Professor Geer Mohammad Ishaq sir has been serving as a faculty in pharmacology at Department of Pharmaceutical Sciences, University of Kashmir, over a last 21 years. Prior to joining University of Kashmir, Professor Geer has served as a drug controller officer of Drug and Food Control Organization (JNK) for a period of 3 years. Professor Geer has completed his post-graduation in pharmacology from Rajiv Gandhi University of Health Sciences, Karnataka, with distinction, and his doctorate in the same subject from University of Kashmir. He has been instrumental in design and starting a PG program in pharmacy practice in 2009, and in and he is presently in charge of this PG program offered by the University of Kashmir. So, yes, today, sir, delivered his insight on the topic of integrative and holistic pharmacy need for a new dimension. So, sir, you are most welcome on the platform of Pharma, and we want to hear your insight on the present topic of the student faculty development program, lecture number one. Please, sir, over to you.
Thank you. Thank you very much, Dr. Santosh Kumar Verma ji. Thanks to the entire Pharma Lok team for giving me this opportunity. My regards and best wishes to the mentors, to the Gurujans, to the members of Pharma Lok team. And once again, I congratulate the whole Pharma Lok team for starting this lecture series on a very important occasion, that is the World Pharmacist Day, which is celebrated every year on September 25th. And in fact, there is also National Pharmacovigilance Week celebration going on from 17th of September to 25th of September. So as part of that National Pharmacovigilance program, as well as the World Pharmacist Day celebration, this lecture series will be very helpful for our faculty and students to understand the various emerging areas, various upcoming advances and recent trends in pharmaceutical sciences. And I'm sure all the lectures that will be delivered by eminent and renowned guests and speakers will be of immense help to the students as well as to the faculty in updating their knowledge, in updating their skills and competencies, and knowing what's happening at present in this field worldwide, at global level, at the national level. And I'm sure that they will also be in a position to take up new challenges, new areas of research, and understand new concepts that are emerging in this field. So I thank the Pharma Lok team, which is led by Shri Amit Jaji, for starting this lecture series and giving me the first opportunity to deliver the first presentation. And I just thought that I will deliver my presentation on this topic of integrative and holistic medicine, which is adding a new dimension to the field of pharmacy. So I'm not sure whether any lecture has anywhere been delivered earlier on this topic. I haven't seen any. Perhaps this is the first time that I'm going to speak, or anybody is going to speak on this very important topic of integrative and holistic pharmacy. We have been hearing a lot about integrative medicine, holistic healthcare, holistic medicine, but we haven't heard earlier about holistic pharmacy or integrative pharmacy. So this is the right occasion to add this new dimension to the field of pharmacy, wherein we have new thinking, new ideology, new concepts, and we will try to expand the purview of pharmacy. We'll try to expand its dimensions, its influence, and have a holistic view of the healthcare, because worldwide there is this awakening now that people are becoming more and more health conscious. People are getting more and more awareness about health, and they are switching over to holistic healthcare rather than sticking to only one system of healthcare. people are moving over and adopting lifestyle medicine. They're adopting holistic medicine, integrative medicine, wherein everything is it's all encompassing and everything is taken care of simultaneously. So it is time for the pharmacy professionals in our country to think, what can we do to adopt and emulate this new concept of integrative and holistic medicine, integrative healthcare, holistic healthcare, and convert it and transform it into integrative pharmacy. So that is what my topic today is all about. So can I share my presentation? Right, I'll be sharing my presentation. So is it visible? My presentation is visible, sir?
Not now.
Okay, I'll share
Mr.
it.
Ashish, please
Mr.
take
Ashish,
care
may
of it.
please help me.
Yes, it is visible now.
Right, sir. So I'm going into the slideshow mode. So the topic will be holistic and integrative pharmacy, a new dimension in pharmacy, or a quantum leap towards sustainable healthcare. So this is the topic which we'll be discussing in today's presentation. Now, how this idea struck me to deliver at a lecture on this particular topic, it all started from this year's Teachers' Day celebration on September 5, when we had a award ceremony arranged by the Pharma Lok. And during that award felicitation ceremony, I was told to say a few words, and very quickly and briefly, I touched upon integrative and holistic pharmacy during that brief interaction. And that time I thought that I should talk more about it whenever I'm asked to speak. So only yesterday Shri Amit Jaji contacted me and told me to deliver this first lecture. So it was really on a very short notice. I barely could make this presentation today morning itself. But I agree that it is not as per my own expectations, but still I have tried to make it as brief and as precise and as informative as possible. I hope the students and the faculty members attending this particular lecture will like it. So, on this Teachers' Day on September 5, the theme this year was empowering educators for a sustainable future. So, we talked about sustainability, we talked about sustainable healthcare. This very theme focused on the importance of providing teachers with essential tools and knowledge to nurture a generation which is environmentally aware, socially responsible, and capable of addressing future challenges. So, that was one aspect which prompted me to choose this particular topic. Then, this year on World Pharmacist Day, which is celebrated every year on September 25, the theme is Pharmacists Meeting Global Health Needs. So, what we need to do to meet global health needs, what our pharmacists in India need to empower themselves with, what competencies and capabilities they need to adopt and emulate, and what skill sets they need to have in order to meet global healthcare needs. So, that needs to be thought about, that needs to be pondered about. Then, as you all know, that we have sustainable development goals which have been enumerated by 17 sustainable development goals have been established by the United Nations in the year 2015, which have to be achieved by the year 2030. And sustainable development goal 3 deals with good health and well-being. It particularly envisages to ensure healthy lives and promote well-being for all at all ages. So our focus has to be to promote healthy lives and to promote well being. And then, lastly, another reason for choosing this topic was the very ambitious goal set forth by our Prime Minister, the Viksit Bharat at the rate of 2047. So this is the right time when we need to think and deliberate and discuss and ponder what would be the role of pharmacists in achieving this ambitious goal of our Viksit Bharat at 2047, and what if steps, measures we need to take so as to contribute our bit towards this lofty and ambitious goal, and how we need to empower our students, empower our teachers, so that they can effectively and meaningfully contribute towards Viksit Bharat Abhiyan, and making India a developed nation. So all this came, brought me down to this concept of integrative and holistic pharmacy. So, what is integrative and holistic pharmacy? It is an offshoot of integrative medicine. Integrative medicine deals with techniques that support our body's natural ability to heal. Our body has a natural ability to heal, so we need to harness that ability. It also helps us reduce stress and promotes a state of relaxation that leads to better health. And it can help us achieve optimal health when we engage in our own healing and feel empowered to make lifestyle changes. So, the idea is to empower our own body to heal itself, empower ourselves to make certain lifestyle changes in order to get the optimal health care. And adding integrative medicine to our healthcare routine will help us regain control of our well-being. So the focus here is on well-being, is on wellness. It is on getting good health through our own inherent mechanisms, empowering our own body to get that rather than fully depending on allopathic medicines. Because worldwide there is increasing awakening, increasing consciousness about the hazards of medicines, dangers and perils of medicines. All of us know that medicines have side effects, adverse drug reactions. They cause drug interactions. There are medication errors. There are inappropriate therapies, overprescribing, polypharmacy. There are issues like self medication, substandard and fake medicines. Then, on top of all, there is irrational use of medicines. It is believed that, as per WHO figures, more than 50% of medicines worldwide are not used rationally, appropriately. So, with all these issues at hand, that all these dangers and hazards of modern medicines, there is an awakening that we need to switch over to holistic pharmacy, lifestyle pharmacy, integrative pharmacy, which will empower our own body to take control of its own health. And for that we need to utilize our knowledge of pathophysiology of disease. See, we started teaching pathophysiology. I think it was brought in education regulations 2014 by the Pharmacy Council of India. Prior to that, only few colleges were teaching pathophysiology. All the colleges and universities were not teaching pathophysiology in pharmacy. But then it was incorporated officially from from 2014 through education regulations. And then we started gaining knowledge about etiology, pathogenesis, the risk factors, diagnosis, signs and symptoms, clinical course, morphological changes, and treatments and complications of various diseases. So now we have been studying this pathophysiology for the last 10 years. For a decade now, we have been making an in-depth study of the various mechanisms of disease, why of disease, how of disease, signs and symptoms and diagnosis of disease, treatment and management of disease, its clinical outcomes, its risk factors. Now we are thoroughly, acknowledged and informed about all of that. And now it is time to switch over to a whole new concept, whole new dimension of holistic and integrative pharmacy, wherein not only we will rely on the allopathic medicines, but we will also take due care of our diet, of our nutrition. We'll also take due care of our lifestyle, whether we are undertaking physical exercise, physical activity or not. And we'll also connect with nature, and we'll also connect, we'll have proper sleep, proper stress management, we'll get proper exposure to sunlight, we'll connect back to earth, we'll connect back to sunlight, and we'll connect back to nature, so that we can harness the inherent potential of our body to overcome disease, to maintain proper health and well-being. That is the idea. So this holistic and integrative pharmacy is leading us towards a new era of pharmacy, from part to whole, from micro to macro. Because this is leading us simultaneous convergence and divergence of disciplines. There was a talk of super specialization of pharmacy. Our previous president of the Pharmacy Council of India, Professor B. Sureshji, once delivered a lecture in which he discussed in detail about super specialization of pharmacy. That is very much needed and need of the hour to switch over to super specializations, because that is the trend worldwide. But at the same time, going into specializations, going into micro, we also need to take a holistic view of the body, the system, how it works, and the effect that it produces at the holistic level. So convergence and divergence has to occur simultaneously. because science and technology has emerged from analysis to synthesis, from partial to whole, from structure to function, from static to dynamic, and from complex transformation has been made possible. Therefore, this holistic integrative pharmacy has become inevitable as a result of the leap taken from quantitative changes to qualitative changes during the development of pharmacy, and a new era of pharmacy from micro to macro, from structure to function, and from static to dynamic is going to occur in the years to come. So I am proposing this model, this new care model of well-being, new model of healthcare today at this platform of Pharma Lok, that we need to give education to our pharmacists to regarding integrative and holistic pharmacy. Our curriculum has to be developed accordingly, wherein they will have adequate knowledge about nutrition, about food supplements, about diet therapy. They will have full knowledge about lifestyle, physiotherapy, physical exercise, physical fitness, importance of physical fitness, because every treatment begins from lifestyle changes, whether it is the treatment for hypertension, diabetes, or any chronic degenerative disease. It has to start from changes in lifestyle. So lifestyle medicine is the key, and we need to switch over to the model of wellness. See, as you all know, we have been studying this in pathophysiology, that if you start from a neutral point in the middle, and you start making awareness about disease, spreading education about disease, it leads to growth of the person, and it takes him to the state of wellness. So on the right side of this neutral point is wellness, while as on the left side of this neutral point is the signs, symptoms, disease, disability, and sometimes premature death. So we need to push our population, we need to push our patients, promote healthness towards the wellness, and we need to take them away from death, disease, disability, and signs and symptoms. So that can be done through proper awareness, proper education, proper lifestyle management, proper preventive measures. The healthcare has to be preventive, proactive, it has to be rehabilitative, not just curative, and not just symptomatically treating the disease. It has to be holistic in nature. We have to make it preventive as well as proactive, and try to avoid disease, try to prevent disease, so that the person moves from illness to wellness. So this illness wellness continuum is very, very important paradigm on which we need to work, and we need to think about, so that we can take our patients towards wellness. So for this, the pharmacist has to be fully equipped. For this, the pharmacist has to be fully empowered. He should have sufficient knowledge about disease, about health, about wellness, about lifestyle, about food, nutrition, about various elements of nature which help in good health. So only then he can promote this kind of integrative medicine. Because as you all know, illness is, there is not one single dimension about wellness. It is a multi-dimensional facet, it has several dimensions. Wellness is not only always, see, the World Health Organization defines health as a state of complete physical, mental, social well-being, not just absence or of infirmity or disease. Just absence of disease is not good health. Just absence of disability or infirmity is not good health. It is a complete state of physical, mental, social well-being. Only when you are in a complete state of social, mental, physical well-being, you can be termed as healthy, or you can be termed to be moving towards wellness. So wellness has all these dimensions: emotional, financial, social, spiritual, occupational, physical, intellectual, and environmental. So we need to address all these dimensions simultaneously in order to make our population healthy. See, we are talking about Viksit Bharat at the rate of 2047. That dream can only become a reality if our population, if our people are healthy, if they are away from disease, if they are moving towards wellness. So we need to address all these dimensions, the determinants of health, whether it is the poverty, whether it is whether it is their economy, or whether it is their equality, parity, whether it is peace, harmony. Everything has to be simultaneously considered. Then only we can achieve progress in all these dimensions, because health is not only physical dimension, it has a huge mental dimension, intellectual, social, environmental, spiritual, occupational dimension. So then coming to the different terms that are used to describe lifestyle medicine or integrative medicine. See, these are some terms which are often used synonymously, but they are different. Lifestyle medicine, for example, is a coordinated team based approach to healthcare that integrates six vital pillars of good health. And these six pillars of good health are used to treat, reverse, and prevent chronic lifestyle diseases. For example, hypertension, diabetes, obesity, fatty liver disease, thyroid disorders, many other diseases, heart related, cardiac disorders, stroke, and all. So they can be easily prevented. Chronic diseases, lifestyle diseases can be prevented through the integrative medicine approach. See, when we talk about integrative pharmacy, it is not an alternative to conventional pharmacy. Integrative medicine is not an alternative to conventional medicine. Please make a note of this very important point. It is a basis, a genesis, a point of origin from where the new modern medicine has taken shape. So this is the basis. We have to start from lifestyle changes. It is not that it will replace the conventional medicine or it is an alternative to the conventional medicine. No, it is the basis. It is the basic starting point from which we have to emerge. This is the foundation of the modern medicine. So these six pillars of healthcare, when we take care, we will need the help of physicians, dietitians, physiotherapists, mental health experts, lifestyle medicine practitioners to harness these six pillars of healthcare and to achieve progress on all the six pillars. Then only we will be achieving the lifestyle medicine goals. Similarly, integrative medicine focuses on us as a whole person. We take view of the person holistically, and not just on his illness or disease, not just on the organ which is suffering from a disease, not on the tissue or the cell which is suffering from the disease, but holistically we look at the whole system, whole body, and we try to overcome the main causes of disease, the root causes of disease, and we try to switch him towards health and wellness by overcoming those root causes of disease. So we need to address physical, mental, emotional, spiritual needs. So it is the heart, body, mind, and soul. Everything has to be taken care simultaneously. The heart, the mind, the body, as well as the soul or the spirit has to be taken care simultaneously. That is what integrative medicine is all about. But are our pharmacists equipped as on today? No, they don't know what diet therapy is all about, what lifestyle medicine is all about, what physiotherapy is all about. They have no knowledge, they have no information, they have not been taught about these physical activity or diet therapy or nutrition or the importance of nature. Though they have fair knowledge about herbs, they have good knowledge about pathophysiology, but mostly they remain focused on pharmacotherapy, that is treatment of disease using drugs. But as per the new awakening which is happening worldwide, people are using less and less of medicines because they have side effects, because they are chemicals. They are poisons if not used properly. The poisons become medicine if used properly, but medicine can become a poison if not used properly. So essentially, modern medicines are chemicals which are not a natural part of the system, and the body often reacts to them and produces adverse reactions. So we need to minimalize, we need to decrease the use of medicines as much as possible to the bare necessity, what is prescribed by the doctor. Very little that is needed should be used. But of course, compliance is important, adherence to the prescription is important. I will not say that we should not adhere to the prescriptions, to the advice of the doctor. We should adhere, we should comply with the directions of the doctor, but at the same time the doctor should also have the awakening to use minimum medicines, and they should not resort to any kind of polypharmacy, any kind of overprescribing of medicines, particularly to children, particularly to elderly patients, particularly to pregnant ladies. And the prescribing should also be adopted. Alongside prescribing, they should also adopt deprescribing and remove all unnecessary medicines quickly in real time. and so that patients do not get unnecessary medicines, they do not produce unnecessary impact on the liver, on the kidney of the patient. And because liver is the machinery which processes all the food and medicines, so when you are giving unnecessary medicines, that means you are supplying unnecessary chemicals, unnecessary poisons to the body, which will definitely have an adverse effect that needs to be avoided. So that is what holistic medicine is all about. It is an attitudinal approach to healthcare. It addresses psychological, familial, societal, ethical, and spiritual, as well as biological dimensions of health. And the holistic approach emphasizes the uniqueness of each patient. Each patient is unique. Nowadays, there is a lot of buzz about personalized medicine. There is a lot of buzz about precision medicine because each patient is unique. We cannot have one pill for all the ills. We cannot have one pill for all the patients, and we need to be very very personalized, very very specific who is to be treated with what. And that is what holistic medicine does, taking the whole system, whole body into consideration, and overall healthcare into consideration, while suggesting measures, while suggesting changes in his food, in his lifestyle, in his daily routine, in what he consumes, in what he does not, what he does and what he does not do. And that is what in complementary and alternative medicine, which refers to a broad set of healthcare practices which that are not part of country's own traditional or conventional medicine. Herbs also come under that. So use of herbs is good because they are a part of nature. The herbs, we have these fruits and vegetables, they themselves contain a lot of medicines. The active ingredients of for example, tomato has lycopene, which has medicinal properties. So similarly, ginger has gingiberone, essential oils, and all, which have medicinal everything that we eat, everything that exists in nature, whether you take the carotenoids, the polyphenols, the terpenoids, everything, all of these are medicines. So, as they say, if you eat your food properly, what is the need for medicines? And if you do not take your food properly, what is the use of medicine? That is the crux of the whole matter, that we need to switch over to this convergence. See, earlier we used to say that disease starts from a cell. When there are changes in subcellular elements, the cell becomes diseased. When many cells become diseased due to the pathophysiology involved, the tissues becomes diseased. Whole tissue becomes suffers the pathology or alterations in structure and function. Then whole organ becomes diseased, and then it affects the organ system, and finally it affects the body. So moving from human whole body to cell, now we are coming back from cell to the whole body. Holistic medicine comes back, diverges back from cell to the whole body. That is what I was talking about, is meant by convergence and divergence. Convergence takes us to the cell, divergence takes us back to the whole body. We know what are the various causes of disease: physical, biological, chemical, immunological, nutritional, infectious, iatrogenic. All these are causes of disease. So we need to see it holistically, taking whole system, taking whole body into consideration, rather than percolating down to the level of molecular level, to the subcellular level. Of course, that is also required. I don't say we should stop that. We need to do molecular biology, we need to do biotechnology, we need to see things at the molecular level, what changes are taking place. Of course, that has to continue, but at the same time we should not forget the holistic view of the whole system, the whole body, which we are at present somehow trying to forget. And we are moving more and more, we say there is a problem in one cell or one organ or one tissue, so address only that. But we forget that it affects the other tissues as well, other organs as well, and then the whole body becomes disease. So disorder has to be converted into order. We say disorder, we also, that is the other name for disease. So disorder has to be transformed back into order. That is what is the aim of holistic medicine. So therefore, 6 pillars of lifestyle medicine, there are these 6 pillars of lifestyle medicine or integrative medicine. That is healthy eating, that is exercise, restorative sleep, positive social connections, social relations, minimizing risky substances, minimizing use of chemicals, harmful substances, poisons, and even medicines, minimizing use of medicines, and stress management. These are the 6 pillars of lifestyle medicine. So that is this is what we need to train our pharmacists in, That is, our pharmacists should not only have a knowledge of disease and drugs, they should not only know about disease management and drug therapy management, they should not only be taught about pathophysiology and pharmacology, but they should also have some basic knowledge about nutrition, diet therapy. They should also have some basic knowledge about exercise, the physiotherapy. They should also have some fundamental knowledge about stress management, the mental health, and then social support, the social pharmacy, how social connections are important, how social relations are important, how parity and equality is important, how social justice, social security, and social solidarity is important, how sleep is equally important, 8 hours of minimum 8 hours of sleep, because that brings out all the toxins from our brain. And if we do not sleep properly, our toxins accumulate and cause many mental disorders, psychiatric disorders, and many brain disorders like Alzheimer's disease, dementia, etc. And then avoiding risky behavior, smoking, alcoholism, avoiding use of many other addictive substances. So we need to teach our students in all these areas. We need to, our faculty needs to orient themselves. They need to develop them, their skills and competencies in these areas, so that our pharmacy should not only be restricted to a drugstore. Our pharmacy should not be restrict their knowledge and their services only to delivery of medicines, but they should be in a position to talk about good nutrition, the importance of exercise, how to manage stress, how to have social support and sleep, proper sleep, and how to avoid risky behavior. So this is what I am today, on the occasion of World Pharmacist Day. I am proposing all these new paradigms, new dimensions in pharmacy. I hope there will be takers to this. People at the helm of affairs will duly consider this. We have a lot of gurujans, we have mentors in Pharma Lok who are well versed, who are experienced, who are experts in their own fields. I'm sure they will have a proper consideration of all these facets, and they will adopt these changes in our pharmacy curriculum, in our training, and they will try to develop pharmacists as multidisciplinary, holistic, all-rounded professionals. There is a lot of discussion these days on multidisciplinarity because of the new national education policy. We are saying that we need to teach people, they should know something about everything, many things about few things, and everything about something. So that is what multidisciplinary education is all about. So I'm sure that people at the helm of affairs will take due cognizance of this fact, that in pharmacy also we need to adopt multidisciplinarity. We need to adopt lifestyle medicine, which is a key to sustainable healthcare. See, bringing you back to sustainability. I talked about sustainable development goals. I talked about the theme of this year's World Pharmacist Day and theme of this year's this September 5 Teachers Day. Everything was focused on sustainability, how we can help our future generations to have sufficient resources without exploiting them today, and how we can help them have a long lasting healthcare, sustainable healthcare, without affecting their own bodies and their economies. So a lot of money is being spent on modern medicines. New drugs that are being approved by US FDA are being charged at thousands of dollars, not in rupees. They are being charged in thousands of US dollars. So it is putting a huge economic burden on the patients, on the pockets of the patients. Therefore, we need to adopt these 6 pillars of lifestyle medicine, which includes a whole food, a plant-based food, plant-determined eating pattern, physical activity, restorative sleep, stress management, avoidance of risky behaviors and substances, positive social connections. Because lifestyle medicine is not a different type of practice than conventional medicine. I am reiterating this point. We are not suggesting some new science or new technology. It is not a different from conventional medicine. It is actually the foundation of conventional medicine. So similarly, the lifestyle pharmacy or integrative pharmacy is the foundation of modern pharmacy. Clinical practice guidelines for the top lifestyle related chronic diseases support this lifestyle medicine as first line treatment even before medications. You go through any clinical practice guidelines of American College of the Psychiatry, American Association of Menopause Society, or any other heart, this Association of Cardiac Society. Everywhere they say that you should start from making lifestyle changes and you should lifestyle related chronic disorders can be prevented. They can be reversed also. There are things like hypertension or diabetes, or by making appropriate lifestyle changes and adopting a holistic healthcare approach, they can also be reversed. The rise in these chronic disease and related healthcare spending in the United States has led to this, made it unsustainable. So therefore, we need to switch over to these new techniques of integrative and holistic pharmacy. So this wheel is known as the integrative medicine wheel, in which there are various therapies taken together in a collective, collaborative manner, whether it is the surgery, whether it is the pharmaceutical drugs, the herbal medicines, nutritional medicine, lifestyle and behavior, whether it is the mind, body, soul medicine, or energy medicine, or it is the manipulative therapies. Everything has to be taken together in order to achieve the goals of integrative medicine. That is why this wheel is known as integrative medicine wheel. And in this we take due cognizance of both functional medicine and lifestyle medicine. Functional medicine deals with the actual cause of disease and eliminating the root cause of disease. That is what functional medicine is all about. While as lifestyle medicine deals with making lifestyle changes, making changes in the lifestyle of the people, so that they resort to more and more of healthy eating and healthy living in order to stay away from disease. So the essence of integrative pharmacy goes beyond the different types of lifestyle medicine, and integrative pharmacy is the core to the practice of. It is the core. It is not that we are suggesting some new field or new dimension as stated in my title, but it is actually the core of the practice of pharmacy, stemming from pharmacy's origin. If we go back to the ancient times, how pharmacy has emerged, the history of pharmacy, the Rig Veda, Athurveda, the Sushra, this Samhita and Charak Samhita. So there they have suggested these changes very well at the very origin, at the very core of the practice of pharmacy. So all we are suggesting today is going back to the basics, going back to the core, going back to the origin, rather than suggesting something new. So the characteristics of this integrative medicine are that it will not replace the primary care physician. It is not meant to treat acute conditions. It is not meant to treat medical emergencies. It is only meant to treat chronic debilities, chronic diseases. And it will not replace the primary care physician or the specialist. The doctor's advice will have to be taken, but it will only join together various therapies and various modes of treatment, various modalities for taking the person from illness to the wellness. It believes in our physical, mental, emotional and spiritual needs that affect our health, and fulfilling those needs. It believes those who need to rely on each other and affect our entire well-being. So there are many different aspects to address this integrative medicine, and all these things need to be taken into active consideration simultaneously. So in this, the most important is food, what diet we take, because Hippocrates, the father of medicine, has said, our food should be our medicine, and our medicine should be our food. Let food be thy medicine, and medicine be thy food. Because when, if you are taking proper diet, there is no need for medicine. And if you are not taking proper diet, there is no use of medicine. Medicine will not do any good if your diet is wrong. But when your diet is right, medicine is not needed at all. So if you don't eat your food as medicine, you will have to eat medicine as food. It will become a food. As you all know, early morning when many people rise from their bed, first thing they have to take is a pantoprazole or omeprazole. They have to take a antacid or this proton pump inhibitor or ranitidine. This is food. This is their food. The first food that they take after waking up is a drug, which is not good. That is because they haven't taken their food properly. So benefits of integrative medicine are many. It will take care of the holistic healthcare of the people. Several chronic conditions will be uh, addressed, whether they are the autoimmune diseases, whether they are acute and acute pain. Acute conditions have to be dealt with by the primary care physician or the emergency care physician. But conditions like cancer, cancer-related disorders, then these hypertension, obesity, sleep issues, mental health issues, menstrual issues, menopausal symptoms, infertility, digestive disorders, chronic fatigue. These can be taken due care of through integrative medicine. If we adopt proper lifestyle, proper food, proper, we expose ourselves to sunlight, we take proper sleep, manage our stress well, definitely all these diseases can be overcome. These are the perils of modern lifestyle. Our lifestyle has become sedentary. We do not move, we do not take due exercise, so we suffer from all these diseases have become very common. India is becoming diabetes capital of the world. Worldwide there are millions of cases of diabetes surfacing every year. So cardiovascular diseases, diabetes, stroke, osteoarthritis, then respiratory diseases, all these are perils of the modern lifestyle. And that can be overcome through this lifestyle medicine, through integrative medicine. And as I said, there are also perils of modern medicine, the drugs which we take, which we dispense, which pharmacists deal with. They have adverse drug reactions, they cause medication errors. Doctors many times prescribe a whole lot of drugs which are not needed. I don't say all the doctors, but some of them. Then drugs have drug food interactions, drug interactions, drug herb interactions. There is an issue of non adherence or non compliance, self medication, substandard fake medicine, and irrational use of medicines. So, in order to overcome all this, we need to take recourse in integrative and holistic pharmacy. We need to adopt this in our curriculum, make changes in our curriculum, develop the competencies of our pharmacists in these areas by making appropriate changes in the curriculum, by making appropriate changes in the things that we teach. And we need to give people a fair chance to study all this. And I think that will mark a new beginning in the pharmacy teaching and learning process. If we adopt this curriculum, adopt this syllabus, and adopt these changes on this World Pharmacist Day, that is my humble suggestion, that is my humble submission to the powers that be, that we should adopt these changes, we should emulate these, because worldwide it is happening. People are becoming more conscious about health, and they are switching over to these, more to nature, more to diet therapy, more to physiotherapy, rather than taking more and more of medicines, which is not a good thing. So we should all promote, we should not, a pharmacist should not stick to only dispensing of medicines or sale of medicines, but they should become holistic practitioners. They should become practitioners of lifestyle medicine. They should also become the promoters of healthcare, whole wellness among the people, and they should have enough competence to advise patients on all these issues. That is the humble suggestion which I am putting forth on this very day. Thank you very much for your patient audience. If there are any questions or doubts or comments, I'll be happy to take them. Thank you, sir. Over to you.
Thank you, Dr. Geer. Today, the specific theme of our World Pharmacist Day, you totally comply uh, on the theme that is integrated and holistic pharmacy and need for a new dimension. This is meet sustainable goal of UNDP also, and as you suggest, this is not a new topic for the holistic pharmacy, as we have different uh, system inside the body and work together to make functions properly of the body. Like that type of every stream of the healthcare system is work together and yeah, exert total health, mental, social, economic, and spiritual health to make a perfect human being. So, thank you, Professor Geer, to deliver your insight so beautifully and enthusiastically. So, thank you very
Thank
much
you,
from
sir.
the side of our audience of Team Pharma Lok. And also, I call all the audiences. This is the first lecture of the series in Faculty Student Development Program, which is introduced in the auspicious occasion of World Pharmacist Day, which is finally celebrated on 25th September 2024 from the every organization, and the Pharmacy Council of India also uh, release a circular to celebrate that particular. But series of this 10 lecture in the different topic, I from the team Pharma Lok requested to all the audience to watch on the YouTube channel of Pharma Lok on regular basis. Thank you so much, sir.
Okay, sir. Thank you very
Jai Hind,
much.
Jai
Thanks
Bharat,
a lot.
Jai
It was a
Pharma.
pleasure.